Welcome, everyone. Happy 6th anniversary. My name is Denise Octavia Smith. Thank you for gathering from, I'm sure, what will be all over the United States. I want to thank you to members who are gathering today. Members matter. We care so much about our members, and we could not do it without you. Greetings to you, Sherry. Thank you for throwing that up in the chat. Feel free to introduce yourself. We're going to wait for a few more folks to gather. I want to continue to give shout outs to our ally members, allies. We need you across all sectors. We are so grateful that you have taken out time today to be with us. If you are not a member, but you are getting the National Association of CHW's newsletter, and you found out about this 6th anniversary and said, "What is this?" Welcome to this webinar. You're going to be hearing from staff. You're going to be hearing from board members. You're going to be hearing from founders and current board members. We're just thrilled that you are with us today. Hello to each and every one of you. We'll give it about another 30 seconds or so, and then we'll get started. Thank you so much, Tasha, for sharing the slides. Well, once again, welcome to the 6th anniversary webinar for the National Association of Community Health Workers. I am also excited to be here. Listen, my name is Denise Octavia Smith. I'm a community health worker and the inaugural executive director of the National Association of Community Health Workers. 6 years ago, I was given the awesome opportunity to join our founders to make history. And that is indeed what we have been doing for the last 6 years. And so it's my honor to welcome each and every one of you, members and partners, strategic visionaries, advocates, community health workers, promotores, peers, community health representatives. We've got an exciting webinar for you, so let's get started. Next slide, please. So today we're going to have a welcome from our board chair, Lily Fox. We'll do about 10 minutes of highlights of our strategic plan achievements. We have been implementing a strategic plan beginning in 2023. And so we just want to give you some quick highlights of what we're doing and why. We will hear from our member and partner engagement manager around some benefits and updates. We're going to hear a little bit about Mental Health Awareness Month and a new project that we've launched in partnership with the Department of Labor. You are going to get a chance to join, meet, share, and grow on the new app, CHW Connector, the app developed by CHWs for CHWs. And then you're going to get a chance to hear about the 2025 Unity Conference. We are all excited to be in person again together. We were in person in 2023, and we can't wait to register, book our hotel, get our flight, train, plane, whatever we're doing to be in person. We'll hear some reflections from the past and the present and the future movement of not only CHWs nationally, but from community health representatives. And then we'll have a quick wrap up. With that, I would like to briefly introduce our current board chair. I want to welcome Lily Fox. Lily's got a great bio on our website, and she says, "If it's meant to be, it's up to me." These lines govern the life of Lily Fox, serving the community for over 40 years. Ms. Fox has been involved in all aspects of community service, from mentoring, molding, teaching, and organizing. Lily's been in all aspects of servant leadership, from school, churches, prison, and every arena. And noticeably, her special dedication, and I know her deep heart, has been to care for babies, mothers, fathers, and families for the last 3 decades. So many accolades. She's a member of many organizations, including the South Carolina CHW Association, a graduate of Coker University, where she earned her BSW, and so many other things. So please go to the website. But I want to bring forward right now Lily Fox.
Anniversary for NACHW. I want to welcome the CHWs, CHRs, promoters, members, board members, founders, and HRA staff. It is a pleasure to see all of you here today in this space where we are celebrating our 6-year anniversary. And then with that, cause I would like to introduce to you the driving force behind NACHW's board, and that is our board members. Next slide, please. Thank you. And what you see here is this is half of the board. These are your current board members from each prospective state. These are the people that you have voted to represent your voice at NACHWs on the board. And I just want to say welcome. Can you do the next slide, please? And these are the remaining members and these are your current board members. And again, I say welcome. And I'm sure you will enjoy the program that we have scheduled for you today. And I look forward to seeing you all at the Unity 2025. Thank you.
Thank you so much, Lily. So as I mentioned, for the next 10 minutes or so, I'm going to run through some really high-level highlights of our strategic plan. If you go to our website, you will find the complete strategic plan, and I'll ask a staff member just to throw that into the chat. But I'm really excited to share with you some of the things that we've been doing over the last couple of years. Our strategic planning process included broad participation from stakeholders, including over 300 NACHW members. NACHW staff, board of directors, many committee members, and CHWs across the country. We did a lot of data gathering for this plan, including 15 key informant interviews, 5 focus groups, 2 in Spanish and 3 in English, and a member survey with 314 members present. And we resulted, after many, many discussions, with 6 priorities. And so briefly, I just want to highlight some of the activity that has taken place in these priorities. Priority number 1, which is the slide you see here, is about training, professional development, and workforce development. And some of the highlights include that since 2023, the National Association of Community Health Workers has held 3 member town halls, in addition to our annual meetings that we hold every year, attended by over 550 members. NACHW now has members in all 50 states and several U.S. territories. Our membership currently stands at over 2,400 active members and more than 4,500 unique members. NACHW co-created the Health Equity Community Collaborative during this time, reaching over 30,000 CHWs, community organizations, and public health advocates with webinars on vaccines, equitable funding, self-care, and belonging. And NACHW now has a thriving national ambassador program. We have over 20 ambassadors who have recruited over 60 members just since the summer of 2024. Finally, I just want to say in this priority that since 2023, we've developed a number of critical tools, including the 6 pillars of the profession, and different tools and resources to help CHWs become fully realized in the public health infrastructure. These tools include principles and strategies to develop an equitable community health worker study and recommendations for public and private ally organizations to contract with CHW Networks and professional associations. And finally, our Workforce Development Committee has been very active, training hundreds of allies and CHW employers on promising practices for CHW employment. Next slide, please. Thank you so much, Tasha. Well, our second priority is policy making and advocacy. And sometimes we are best known for this priority. It's been a critical priority for community health workers to be understood for our identities and to have infrastructure, including state, employer level, and federal policy that respect, protect, and authentically partner with us. In the last 2 years, we have delivered technical assistance to 12 different CHW networks or professional associations in different states around the country. I want to give a shout out just today. We heard great news that the Arkansas CHW Association has finally received an act that was passed by Governor Sarah Huckabee Sanders that advances CHW certification and specifically names this CHW-led Arkansas CHW Association. So we're thrilled for that news. Other things that we've been doing here at NACHW include co-hosting a bi-weekly national CHW policy working group with our ally partners, Partners in Health, that have engaged 150 different organizations and has been impacting at least 13 unique bills across the country, many resolutions and movements within states. Finally, that National Policy Working Group is led by 5 community health workers who came through an application process, who we contract with for their leadership. Next slide, please. As you can see on this very, very busy slide, we're working in partnership and we've got over 566 individuals who are attending our National Policy Working Group. You can see some of the data of the folks who are, coming to these meetings and just what we've been able to achieve. And we just came from an amazing 3rd annual National CHW Capitol Hill visit. Wow, we had an incredible panel on that visit. I think some of you were with us. I see the chat sort of blowing up. This is our 3rd year, and we had over 100 different meetings with our federal legislators, representatives, and senators to share the great work we're doing at the local level, to tell the stories of CHWs in our communities. Stephanie, I see your celebration. So we're doing great things in this priority. Next slide, please. Well, here's a priority we care very much about, and that is partnering with and amplifying the leadership and vision and assets of our CHW networks and professional associations. I like to say that we are a network of networks. Many of the CHW networks and professional associations have been around many decades longer than the National Association of Community Health Workers. We're just celebrating our 6th birthday. Some have been around indeed since the 80s. On the screen, you can see a picture of an incredible event that we hosted last October, where we brought some leaders from across the country and we came together to mentor one another, to talk about the challenges and successes in our vision for leadership, and to co-author recommendations and practical action steps to advance the federal initiative around the public health infrastructure. We're going to be releasing that tool first, but I just want to take a moment and celebrate. If you are a CHW network or association leader, we are so grateful for your membership. We're so grateful for your partnership, for the advocacy that you are doing at the state level. And we thank you for bringing your voice to the federal level in a way that is moving and advancing our profession. Next slide, please. Well, I'm almost out of time, so quickly, let me just talk about some of the activities in our racial and health equity goals. First, I just want to say that we do not sequester concepts of racial and health equity. They permeate everything that we do. The National Association has identified 28 different languages within our membership, And when we asked CHWs to self-identify, we had well over 35 different ethnicities and races. So we are a diverse national membership in all 50 states, about 30 indigenous tribes, and a growing number of U.S. territories and freely associated states. In the last 2 years, we partnered with the APHA, the American Public Health Association, CHW section, in the release and distribution and advocacy of a strategy to address systemic racism and violence as a public health priority by training and supporting community health workers. We've done national podcasts with the Robert Wood Johnson Foundation and Ohio State University on community health workers building critical futures for public health. And finally, we have written and spoken out globally about labor exploitation of CHWs around the world because we know that this predominantly female workforce, 51% of them globally are not paid at all for the critical work that they do. So I'm so proud. I just want to thank my staff. I want to thank the committees, the members who participated, all of the board members who have been advancing these priorities. Next slide. In my final comments, I just want to acknowledge that we would not be on this webinar. We would not be celebrating a 6th anniversary. Indeed, I would never have had the opportunity to grow my own leadership were it not for the founders of the National Association of Community Health Workers. Our founders, predominantly community health workers, promotores. We had one auntie from a Native Hawaiian community. We have had community health representatives from the Laguna Pueblo and the Navajo Pueblo who were among our founders, and cross-sector allies who came together and believed that we could build a movement. When I was hired, I heard Wandy Hernandez tell me, let's make history. And I believe we have been doing that ever since. We lost a great founder, and we have been celebrating her for well over a year. We will continue to celebrate the great Naomi Cottoms, a founder of many organizations within the state of Arkansas and one of the founders of the National Association. If you were with us in 2023, you were able to see her and some of the other founders on the stage. You can see them accepting an award. We are so grateful for a foundation. How else can we build unless we have a foundation? We cannot forget where we came from, because in truth, that is how we will remember where we are headed and make sure that we're headed in the right direction. And with that, thank you so much, founders, and we're grateful to be here. Next slide. Wonderful. So I want to hand off the webinar now to a great partner, leader, and my colleague, Aurora Grant Wingate. Thank you, Aurora.
Thank you so much, Denise. Hi, everyone. Thank you so much for being here today. My name is Aurora Grant Wingate, and I am NACHW's Member and Partner Engagement Manager. And I'm just going to spend a few minutes talking about some of our newer membership benefits that we hope many of you will be able to utilize. So first, as an announcement, NACHW now has over 2,400 members in all 50 states and several of the U.S. territories. This is a huge accomplishment. We spend so much time trying to make sure that we have a diverse and representative membership that really represents the diversity of CHWs across the nation. Next slide, please. And if you are a NACHW member, or if you would like to become a NACHW member for $20 a year for individual CHWs, here are some of the benefits that we now offer. We have a new live member directory, which members can opt in to being listed. So you can connect to CHWs who may be in the same state as you, or who have a similar specialization. We also have continuing education tracking through our MemberClicks portal, where you can add certificates of attendance, different trainings, and then download that all in hopefully one convenient place. Next slide, please. And we are working constantly to help better show stories from across the country and the amazing work that our members are doing. Each month, our comms team puts in our members' newsletter a submission form so we can represent your stories, hear from all the great work that you're doing. We have themes each month, so please feel free to take a look next week or 2 weeks when our members newsletter comes out and submit your story. Next slide, please. And then we have a variety of membership webinars and events we do throughout the year. I believe some of my colleagues are going to talk about this more, but last month we just completed our 3rd annual NACHW and Partners in Health National CHW Capitol Hill visit. This is a benefit for our members. We took over 100 CHWs to the Hill this year, as well as our Workforce Development Committee has been doing incredible work trying to put together some resources for CHW employers and our ally members. They just completed their 2nd annual ally webinar, as well as putting together a promising practices report that everyone can check out. As well as we do various policy calls and advocacy trainings throughout the year for our members and other special events. So please feel free to keep a lookout for our members newsletter for that. Next slide, please. And now we are working to recruit additional NACHW ambassadors. These are an incredible group of around 20 CHWs from various states who are working to help us spread the word of NACHW and NACHW's resources. They are now also putting together mentorship programs and doing trainings. I really love getting to spend time with them each month. So if you are interested, please feel free to let me know and ask me questions. And we have a way to apply here on screen. Please consider joining us. We'd love to learn more about you and get to spend more time with you. And now I'm going to hand it off to my colleague Marlene to talk more about the Fair for CHWs project.
Thank you, Aurora. Hi, everyone. My name is Marlene Rivera, and I'm the Executive Administrative Manager with NACHW, as well as the project manager for this initiative, the Fair for CHWs project. In addition to leading the project, I'm also one of the advisors. I bring with me not only my professional background as a veteran, but also my lived experience, both from my childhood and as an adult. Sorry. As someone who has had to navigate parts of this system firsthand, I know how important safety, understanding, and compassion are in spaces like these. The Fostering Access, Rights, and Equity Fair for CHWs project addresses the urgent need to support community health workers, predominantly women of color who face inequities, workplace violence, and harassment. CHW's unique lived experiences enable them to effectively serve marginalized communities, yet their roles exposes them to heightened risk, including gender-based violence and harassment. By fostering awareness, advocacy, and healing, FAIR empowers CHWs to protect themselves, seek help, and build safer, more equitable workplaces. Next slide, please. Thank you. In April 2024, NACHW conducted a survey for CHWs and their employers, confirming the need for intervention. This survey consisted of 335 CHWs in 47 states, 57 CHW employers, and 30 CHW trainers. CHWs in Alabama, Georgia, Mississippi, and North Carolina reported significantly higher need for services and legal assistance related to GBVH than national CHW respondents, which is why with this Department of Labor grant, we are currently working with those states. Within the project, we also have an advisory team. These individuals, who are 60% CHWs, bring a wealth of lived experience, professional insight, and deep commitment to CHWs and the community they serve. Next slide, please. Thank you. May is also Mental Health Awareness Month, and we're going to use Mentimeter for a quick interactive activity, using it as a journal prompt. So please, if you can take a moment to go to www.menti.com on your phone or device. The first question on the left is specifically for CHW, so we want to hear from you directly. This question can be found by typing in code 49245188. And the question is, what does speaking up for myself sound like, feel like? The second question is for allies and employers, and your perspective is just as important. That code is 59726099. And the question is, what does being a true ally in the workplace look like in action? Once you're in there, follow the prompts and add your responses, please. We're still on that same slide. Thank you. If you need any help getting into the Mentimeter or the code, please, I see some people already in there.
Can you say the code again, please?
Yes, the one for CHWs is 49245188. And the one for allies is 59726099. I see someone responded to the CHW question, having to justify what I'm doing and show how it benefits the providers. Speaking up for myself feels a bit scary sometimes because usually I'm speaking up for others. But once I do speak up for myself, I feel liberated, happy, strong, and free. I'm going to go into the allies one. One of the responses, listening, listening, listening. Another one for the allies, being willing to risk backlash for speaking up when needed. And another one for the allies and the employers, advocating for and providing support to CHWs. Wow, there's so many responses. This is awesome. Establish healthy boundaries such as work-life balance is a response under the CHW one. Again, for CHW, it sounds empowering, confidence and confirmation. For the CHW, some may say it sounds harsh, but I feel that my demand for respect is heard, and I feel that I am my biggest protector and advocate. These are amazing, everyone. Thank you so much. I'm going to keep this open so you guys can keep adding more of these responses as much as you want. Thank you for taking the time to participate in this activity and for your valued feedback. Next slide. Thank you. Here you'll find our webpage, which is www.nachwa.com/fair, which includes more information about the state anchor organizations, our advisory team, and a few resources along with the toolkit. If you'd like more information about the project or have resources that you believe should be included on the webpage, please email us at fairforchws@hra.org. Future webinars will be shared in our newsletter as personal development, and it's to protect the privacy of those who need it. Thank you.
Hello, everybody. My name is Michael Matthias, and I'm here to talk to you guys about CHW Connector. As Denise mentioned, this is a platform for CHWs by CHWs. We spent several years, even before I came to NACHW, developing the ideas around CHW Connector, and at Unity Conference last year, we were able to launch the platform, and I apologize, I've been sick today. We have it here for you. You'll see on the right-hand side of this our QR code. So if you wish to download the app version of the platform to your phone, you can do that easily by using the QR code. We also have the website there. But I just want to say, in the last 6 months, we have had over 1,500 users sign up And those are CHWs. You have to affirmatively say I'm a CHW when you sign up to be part of this community. And you do not need to be a member of NACHW to sign up for CHW Connector. So anybody who's a CHW can sign up. We have over 25 CHW networks and associations who have their own pages on CHW Connector to be able to use their voice and to speak to CHWs. We have over 20 topic-based communities pages. These are the CHW-driven pages where we want you as a CHW to go speak to each other, share with each other, and be able to participate in this community of CHWs that can help each other and make sure that everything you have the information you need. You share your experiences. In the coming months and years, we're going to be doing some additional work to optimize CHW Connector, to get notifications working so that you will get notifications directly to your phone and to your email. And we are always adding more networks and communities pages. Even today, I'll have been meeting with 3 different local network associations to get them their own pages and to go out to be able to speak to you. We're very excited to have CHW Connector as an option for you to have and to use. The more you follow, the more you post, the more all of us will get out of it. It is for CHWs and by CHWs. Thank you all so much for giving me some time to talk about CHW Connector.
Wonderful. Thank you, Michael. Hi, everyone. My name is Bernadine Jerringama, and I'm the Associate Director of Communications here at NACHW. And so we're just going to talk a little bit about marketing and comms and then some exciting information about the Unity Conference. Next slide, please. Thank you. So as we do this incredible work, all 6 years of it, we understand that it's important for us to expand our reach and showcase the value of CHWs. We use our website, our social media, and our website has also undergone an overhaul, so that's really exciting. Our social media, our newsletters, as well as all kinds of, pop-up ways of communicating to really communicate the many great things and opportunities that are relevant to our community. So our big one is our CHW Awareness campaign, which it culminates in August of every year at CHW Awareness Week. And so this really keeps the conversation going about CHWs in as many spaces as we can. So last year, 2024, we engaged in a media tour where Denise, our executive director, was speaking about CHWs and the value of CHWs on TV, radio, podcast, and social media. These appearances amassed over 32 million airings across the nation. So these networks have a combined reach of 200 million Americans. And the hashtag for CHW Awareness Week also reached over 1.6 million appearances on social media. So this great work and visibility at the end of the year, as some of you may have seen, culminated in NACHW being invited to the Jennifer Hudson Show, where our website, our mission, everything was on display, as well as a special surprise from our sponsors. And so we're super excited for what comes next. So I will now pass it off to Yanel Powell, who is a board member here at NACHW, and she will share some very exciting news about our upcoming conference.
Thank you, Bernadine. Ohio, if you're in the house, put all your names in the chat. This year, we're going to be in Columbus, Ohio for Unity 2025. And we heard your voices. A lot of concerns were that you were not able to gather and convene and network. So this year, with the planning committee and NACHW staff, we're trying to create an experience for our community health workers. And our theme is from legacy to leadership, and you're going to see that resonate throughout the conference when you're there. It's going to be interactive, educational, and informative, gathering, convening. CHW allies, members, and partners from across the country to celebrate the diversity and resilience of the work. So some workshops which highlight CHW's leaders in policy and research, social determinants of health, workforce development, cross-section partnership, infectious and chronic disease prevention and treatment, and CHW's leading in equity across all topics. In addition to workshops, NACHW will have certificate eligible training, something else that you all were requesting, poster presentations, and exciting keynotes, booths, and local vendors. Next slide, please. All righty, so you can see our logo on the right, Unity. So what you can see on the far left is our purple person, and then on the far right, you see the blue person, and then that kind of U shape encompasses everybody that we're collaborative, we're all one. So again, our theme is from legacy to leadership, and that theme was created in collaboration with our membership, founders, board members, and staff. Unity 2025 will honor the legacy of those who laid the foundation for today's CHW workforce. The leadership of CHW is prevalent in their innovation through community and collaboration. CHWs are healing their communities through the promotion of health and well-being. CHWs are transforming systems by sharing evidence and research resources and approaches at Unity 2025. And I want to say one big thing, and I'm always big on it, even when I ran for board, I'm an advocate for community health workers. And it's time for us to continue to have a seat at our own table. And hopefully after this Unity conference, we're going to be pumped up for the following fiscal year, and we're going to demand our table back. And I'm going to kick it over to Felipe.
Thank you, Yanel. Hi, everybody. Welcome again. Thank you for celebrating with us 6 amazing years and, keeping the Unity theme going. I just wanted to say, it is a very amazing event that we're planning. Like Yanel said, we want to bring CHWs to the table and make this table a center of celebration, right? Unity is not just a gathering. It's a physical and memorable manifestation of NACHW's mission. It is when we come together to create education and unify our voices to create a national community, right? Again, this year it's going to be amazing. I just want to bring back the importance of unity for NACHW and for CHWs around the US because it aligns perfectly with our mission and vision and our strategic plan. Our priorities are training, professional development, and workforce development. This is super important when we create the content and the tracks for the workshops and breakout sessions during Unity. We understand that a lot of us are coming to Unity to get those CEUs and certificates and continuing education and opening up like new practices and sharing our own practices so we can learn from each other. Moving on to our second priority, policymaking and advocacy, occupying a major convention center like the Greater Columbus Convention Center in Ohio is amazing for us. It's creating this space where we can come together and just show the world and the country and everybody that we're here and we're not going anywhere, and we have a lot to say, a lot to teach, and a lot to learn. Of course, a lot to celebrate. We're also involving local officials. Representative Brewer from Ohio, Representative Brownlee, Representative Jarrells, and the mayor of Columbus are going to be all in part of like this organization process and within the celebration as well. Our third priority, which is the oh my God, just unifying that voice, like I said, and just showing how professional our workforce really is to pave that identity, right, for CHWs. If you, like Michael said before, identify as CHW, this is the space for you. We're going to be networking and connecting and creating, an aligned and integrated future for CHWs across the country. Next slide, please, Tasha. And then moving on to our fourth priority, CHW Networks, associations, and community-based organizations. Again, we're engaging with the local boots on the ground CHWs networks to just stimulate everybody that's part of our community. That being said, we're leveraging those local members and leaderships not only to host and co-host the event, but also to help out with like bringing vendors to the table and exhibitors, because we want to engage with the local Ohioans. And then our fifth priority, which is racial and health equity, we're keeping costs low for everybody so that it's not a barrier of entry. We want everybody to have an equal opportunity to attend. We also are keeping a very mindful watch on our carbon footprint this year because we believe in the importance of keeping that impact as low as possible. Finally, like I said, there's a space for celebration, for coming together, and for fostering a joyful environment for CHWs everywhere. Please, next slide, Tasha. That being said, Unity is an event for and by everybody. So this is a call for everyone out there who is connected to a local vendor or a local exhibitor, or a local organization. We have a lot of opportunities for everybody to be involved. So let's collaborate. Let's bring this event to its maximum potential and come together so that we can build a memorable experience for everybody. If you can scan the QR code on your screen, that will take you straight to our prospectus and all the ways that you can be involved in helping making this event a reality. Next slide, please, Tasha.
Is Aurora sharing? I'm sorry.
Yes, and now we have a small Mentimeter activity. We know everybody is curious about the event. Everybody's super excited. So we want to address your concerns and questions firsthand. We're gonna share this Mentimeter where you can share your most important questions. So we'll try to address them now, and whatever we can't get to, during this webinar, we'll try to inform you separately through our newsletters, social media, and of course the Unity website. And then let me just drop that link in the chat in case you didn't get a chance to see the QR code. Yes, we do have a block designated for the conference. We'll be informing everybody more on that in the coming weeks. I love this question. The call for abstracts and speakers will all come with registration. Hopefully at the end of the month or a couple of weeks, we'll have registration open for everybody. Again, stay tuned in social media, newsletters for members and non-members, and our website for more information. And the agenda will come out with registration as well. There will be some scholarship opportunities, and of course, CEs are in the talks as well. Yes, volunteer opportunities are arising. Please connect through your local networks. We're going to be sending all the information for volunteering through them. The cost to attend is $75. Again, all these information will come through registration, but I love the question because going back to our efforts to keeping costs low, we want that equitable attendance opportunity for everybody.
Felipe, there was a question about virtual. It's not going to be a virtual option, but there will be an option for you if you cannot attend to see the new board candidates, to see their speeches and their panel. So we'll be able to broadcast that, but we will not have a virtual option.
And yes, it'll be 2 days of Unity conference, and then we'll have one additional day for the NACHW annual meeting. And hopefully we'll have a photo station and many more surprises for everybody. Registration will be opening at the end of this month. Again, stay tuned. We'll be communicating everything through our social media channels.
And it asks if ambassadors are going to be invited. Everyone is invited. You're all members.
Again, Unity is for all CHWs and allies. So everybody is welcome to come. We'll take a couple more seconds. Absolutely. We'll have, apart from learning and education, we'll have networking and connecting activities. That is one of our central pillars. So stay tuned for that agenda. And again, if you have any more questions, you can send us an email, info@nachwa.org. I'll pass it on. Thank you so much for your attention. Hopefully we'll see you all there.
Hi, everybody. Wonderful to see everyone here. I'm very excited to give you a taste of our theme for Unity this year and highlight from legacy to leadership by hearing from one of our founders as well as a current board member. Unfortunately, the founder who is going to speak is having internet issues. Majeline Begay is a CHR leader who has decades of experience pouring her work into this field. Please read about her work. Her bio is, I believe, in the next slide. And we are fortunate to have two other founders here that are going to share with us. And so Darrell Fox and Gail Hirsch are here. And so we're just gonna slightly shift, but we're still gonna focus on the CHR movement and how CHRs and CHWs have worked under the CHW umbrella to drive forward the movement. I can't do justice to everything these three founders have done for the workforce, for the movement and their careers. But please read, their bios are on our website. So without further ado, Darrell and Gail, would love to hear from you about why CHR leaders are so important to the CHW movement. So feel free to unmute yourself and come on.
I'm honored to be drafted to service for the current board and staff and everybody who's here. Think of me as a former Miss Navajo, which is what Majeline was. So just close your eyes and think that. So I would say this. One of the things that we understood years ago, some of us have been working in this field for decades, was that our futures, our existence is actually intertwined between CHRs, CHWs, and promotoras. If you heard Denise talk about the founders group, we had representation from the East Coast, the West Coast, the South, the middle of the country, Hawaii, tribal nations. So we knew that we had to work together to develop NACHW. And so therefore, CHRs are critical to the CHW and promotora movement because once again, our fates are intertwined together. We tried to unite many years ago under the umbrella term CHW, and that really was around unifying nationally. The other thing I'll say is this. We have an ongoing tribal community of practice. The tribal community of practice began with the Envision Equity team, one of the CCR programs, and the group has decided to continue it. So Majeline and I are both active on this CHR group. It's a tribal community of practice. It's open to other members. If somebody emails me, I could give you information. But I think because our histories, our work that we do, and our futures are all aligned, it is critical that CHRs continue to be part of our leadership. Thank you. I'll pass the mic to Gail or others.
Hi, everyone. I really have nothing to add to what Darrell said. We've been working with CHRs, CHWs, and promotoras for so many years, and to be able to pull us all together under the NACHW umbrella was a major advancement for organizing a unified and diverse field. So the diversity brings strength.
Thank you both so much. Darrell, you're an incredible former Miss Navajo. Very, very impressed. But thank you both so much for stepping in. We really appreciate it. So now we have the opportunity to hear from one of our current board members, Iris Riano. Iris has managed the CHR program in the Pueblo of Santo Domingo and serves on the state of New Mexico's Community Health Worker Certification Board, in addition to the New Mexico Southern Colorado CHR Association Board, which I believe, I actually can't see the writing because it's a little small, but I've heard you lead a coalition of, I think, 19 Pueblos. So feel free to correct me on that, but incredible leader in New Mexico. organizing CHRs. And so Iris, we would love to hear from you a little bit about how NACHW and CHRs can partner in the future to advance our shared goals for community health.
Well, first of all, a happy anniversary to all the CHRs, CHWs, and promotores. I'm super excited for this. And thank you for giving me this opportunity to speak. So to answer your question, the partnership between NACHW and CHRs hold a tremendous potential to drive impact and sustainable improvements in community health. Both organizations can share a deep commitment in advancing health equity, promoting preventative care, and ensuring the vulnerable populations and have access to the resources they need to thrive. And with that, as both Darrell and Gail had stated, the CHRs are very unique. We've been in existence for more than 55, I want to say 55 to 56 years because I wasn't born when it first started for the community health representatives nationally in indigenous populations. So with that, most of the CHRs were grandfathered into CHWs, while in New Mexico, being that we've had the experience that I'm working in our local communities. So with that, the NACHW and with its expertise in empowering community health workers, with its focus on building community resilience and well-being, and are uniquely positioned to create lasting change by working together, can really bring a big difference on some of the areas that our collaboration can lead into, such as advocacy for policy changes, because a lot of them need policy changes, leveraging community networks, which make it stronger, innovative models for healthy delivery into our communities. Together, NACHW and CHR can lead a transformative movement towards community-centered, resilient health systems, and that address both immediate and long-term needs for the people that we serve. Through the collaborative shared knowledge and deep commitment to our communities, we can create a healthier and equal future for all. And that would be working together and making the CHW network stronger, because at that challenge, some challenges are, one thing that I always advocate for is transparency in language and the language barriers. So with that, just making it an equal opportunity to work together and stay stronger for our communities.
I'm wondering if we have a quick minute. Majeline was just able to get on. I'd love to give her a minute to chime in. Majeline, are you able to unmute yourself and get on? I think she's joining by phone. All right, it might be, I see her phone on here. Majeline, I think you just need to unmute if you can hear me. While you're working on that, I'll just kind of remind everyone the question that we had for you, if you're able to come on, which is if you can just tell us a little bit about why the CHW movement is so critical to community health representatives.
Okay, I believe I'm unmuted now.
You are, yes, we can hear you. Thank you.
Okay, all right. Thank you everybody for joining this important call. And my apologies, I don't have internet where I'm at. This is on the Navajo reservation. But I just want to say that I am with another group where we're trying to revive the National Association of CHR. And we had a good meeting last week, And we're going to continue to have a meeting with greater CHRs and then community health workers that would like to help us. So we have a lot of allies and community health workers that surrounds the tribal nation that is interested in helping us revive this organization so that in total we can have a stronger united voices for the CHW, CHR, promoters, and so forth. And so I just want to let you know on that. And right now we're doing some research on some of the documents that we use to form our organization. We're archiving, looking through archive documents to get those out and to see how we can put our heads together to revise this important national organization. And if you're a non-tribal member, I welcome you to join us. And if you want to come to our next meeting, please reach out to me through my email. Nina has my contact information. So with that, I just want to say thank you. And I am really grateful for the great work we're all doing as a community health worker to be a stronger voice and advocate for the CHW profession. And right now we need to be more united because of what is going on. And I don't need to go into detail on that. But we just need to be united and then help each other in terms of advocacy, how we can reach out to our local, state, and national leaders to help us move this profession forward. And thank you so much.
Thank you, Majeline. And if before you mute yourself, I received another question that folks are hoping to hear from you about. If you have a minute to tell us about why it was so important that CHRs, so of course you, and we also have Ramona Dillard, who's another CHR founder. We're part of NACHW from the very beginning, from before we launched, for all the years that you were working to build the organization. Why it was so important that CHRs were part of that and leading that.
CHRs were very important at every level of advocacy. And so the CHRs, us by ourselves, we are unable to carry a strong voice, but we believe in unity. And through unity with our allies, CHWs that are out there, we are stronger advocacy, and we have a stronger vision, we have a stronger plan, we have a stronger development with all of our heads put together. And so the CHRs, just like any state or national organization, we want it to be united, have one voice, and that is why we started our organization. And because we are so huge, we have CHRs throughout the United States. And when we do come together on a triennial basis, we used to reach 800 to almost 1,000 participants at these conferences. And that's when we discuss some of the tribal, local, state, and national issues. And we also had some allies that used to join us. And so we sort of strategize, how do we find solution, how do we overcome these challenges to have a stronger CHR tribal organization. And even though we had monies that was directly appropriated through tribal government, at times we used to be challenged with funding that would be reduced, or either funding that was going to be withdrawn from the CHR program. And so in those challenging years, we had a lot of our allies that help us put together our talking position statements, talking points, and so forth. And so again, with that, we are much stronger with a united voices from all the CHWs. I know within each ethnic group, we call ourselves differently, but we still do the same work, and we're still CHWs. And I hope I was able to answer the question. Thank you.
You absolutely did. Thank you so much. For anyone that's been at other NACHW events, you know, we always bring our history in because it's so fundamental to how we got to where we are, as well as where we're going. So with that, I want to hand it over to Aurora, who's going to close us out, I believe.
Yes, thank you so much, Nina. I want to give such a big thank you to everyone who came to celebrate here today and everyone who presented, our board members, our founders, many of our staff. This has truly been a wonderful opportunity for us to come together and get to share a little bit of the work that we're doing throughout the year. I really appreciate everyone who came to spend a little time with us today. We hope that you are taking away at least one resource or one upcoming opportunity where you can come join us. Our goal is to make sure that all community health workers across the country feel seen, feel heard, and know that you have a larger community that you can tap into. We know that is more important now than ever for you to know that, whether that's logging on to CHW Connector or sending one of us an email, coming to the Unity Conference. We want to make sure that we have the right kind of engagement for you. And with that being said, I'm going to drop a link in the chat. We would love to have a lot of opportunities to hear from you. Please take a couple minutes, fill out our post-event webinar, and let us know how we did, how we can do better, how we can be more engaging during these events. Otherwise, I am happy to say I get to give a couple minutes back into your day. So thank you all for coming. Please let us know how we can help you all as you support us as an organization. Thank you. I hope you have a safe and happy day.